Hi everyone, Ryan Smith at Better Life Carolinas again. I thought today we might talk a bit about inflammation. Inflammation is such an underpinning of many of the diseases of aging that we are commonly treating. And I think it's worth investigating exactly what we mean by that term. We throw it around a lot, but what do we really mean when we talk about inflammation? The best way to approach this, I think, is to begin with an example of what normally happens in an appropriate inflammatory response. So let's come up with a hypothetical. Let's say that you're in the kitchen and you cut your hand with a knife and you have an acute injury. You have broken the barrier protection that your skin provides, and you've created a situation where bacteria now have a port of entry and they can get to your bloodstream more easily. So in that situation where there is tissue injury, your cells release chemical signals that activate white blood cells. Those are your immune cells. And when white blood cells are activated, they in turn release their own chemical signals that serve to recruit and activate other white blood cells that are further abroad. And so it creates a situation where white blood cells are being recruited to the area where they are needed. This release of promoting signals is a cascade. It's a feed-forward effect. The more white blood cells that are activated, the more that can be recruited to the site of injury. And once the white blood cells are activated and they are in the setting of pathogens such as a bacteria, some of them can release free radicals as a form of defense. When we talk about free radicals, we're often talking about them in terms of the danger they pose to our own tissues, but free radicals are actually something that our body uses to fight off infection. And so our white blood cells can release free radicals to eradicate things like bacteria. And our own healthy tissue has antioxidant defense mechanisms to protect them from those free radicals. And ideally, in a normal situation, this whole process gets resolved through separate chemical signals, and the inflammatory response fades back to baseline. And the wound that we initially sustained can then be healed by fibroblasts and the formation of new connective tissue and scar tissue. So that's ideally what happens in a normal inflammatory response. We have this feed-forward propagation of signals that lead to this heightened inflammatory response and then a resolution. But because of the complexity of this system, if anything were to go awry, particularly in the resolution aspect of inflammation, you can easily understand how the whole process can go sideways. And what starts out as an acute inflammation may become a more chronic inflammation. In these situations where an injury is more chronic in nature, or if inflammation goes unchecked, our body's antioxidant defenses can easily become overwhelmed. That might lead to a situation that we refer to as oxidative stress. Normally in the production of energy, there is some degree of free radical production and some degree of oxidative stress that our cells can handle. That's part of the inefficiency of energy production at a cellular level. But if we overwhelm our body's antioxidant defenses, then that oxidative stress, for example, free radicals, they can result in tissue damage. They can cause DNA damage that can have more lasting consequences. This can be a setup for diseases such as type 2 diabetes, heart disease, cancer. So the question then is, what kinds of things can predispose us to these heightened levels of oxidative stress? And these are common triggers that we know about. Cigarette smoking, alcohol, an inflammatory diet, radiation, toxins such as pollutants, industrial chemicals, pesticides. Certain medications can lead to oxidative stress. And perhaps most importantly for our discussion, obesity can be a trigger for chronic oxidative stress. So how does obesity produce oxidative stress? We know that adipose tissue or fat tissue can release chemical signals, bioactive substances into the bloodstream called adipokines. Adipokines are cell signaling molecules. Some of them can be pro-inflammatory, some can be anti-inflammatory. What's interesting is that the balance of pro and anti-inflammatory cell signals tends to be governed by caloric intake. It's apparent in situations where there is caloric restriction, or even starvation for that matter, there is an increase in the anti-inflammatory adipokines and a decrease in pro-inflammatory adipokines. When caloric intake is balanced, when our energy expenditure is roughly equivalent to how much calories we're taking in, then the pro and anti-inflammatory cell signals also seem to be balanced. But in a state that's all too common for our current society, when our energy intake, when our caloric intake exceeds our energy expenditure, that can result in an imbalance of these inflammatory signals, where more pro-inflammatory signals are released and fewer anti-inflammatory signals are released. That sets up a situation where we have chronic low-grade inflammation. So what do we do about that? How can we address that inflammation? Obviously, the answer is to get to the root cause, to address the obesity in the first place. But we all know how challenging that can be. While we're in the midst of addressing the causes of obesity, another thing to consider are things that might temporarily reduce that pro-inflammatory state. That can help with symptoms that people often experience that relate to their chronic disease. For example, inflammation can lead to chronic GI symptoms that we commonly associate with irritable bowel syndrome. It can lead to diffuse muscle or joint pains. It can cause brain fog. All these are common generalized symptoms related to inflammation. One tool that we've been using in our clinic to help address this chronic low-grade inflammation is hyperbaric oxygen. Hyperbaric oxygen seems to affect this inflammatory milieu in a couple of different ways. Number one, it's been shown to directly decrease the number of pro-inflammatory cell signals that your body releases. That reduction in inflammatory cell signals is associated with decreased white blood cell activation, decreased white blood cell migration, and perhaps most importantly, hyperbaric oxygen therapy has been shown consistently to increase the antioxidant capacity of your body. And that allows you to withstand higher and higher degrees of overall oxidative stress. Secondly, we know that hyperbaric oxygen therapy can enhance mitochondrial function. Mitochondria are the small organelles within cells that help to generate energy for cells to use. And as part of that process, they also can cause localized oxidative stress. And it's at that mitochondrial site that antioxidant defenses are often most active. And if we enhance mitochondrial function, we are enhancing that antioxidant benefit. And it's clear that hyperbaric oxygen therapy can improve both the number and the efficiency of mitochondria that our cells have. And this in turn provides lasting benefit against this chronic low-grade inflammation. So to wrap this up, we think of hyperbaric oxygen as a tool in our tool chest to help us address chronic low-grade inflammation, which is such a ubiquitous part of our experience with a standard American diet and with our exposures to things like pollutants and toxins. It's important that we address the root causes of low-grade inflammation, primarily obesity, but along that path, along that journey, it's nice to have tools to help decrease some of the symptoms that might be associated with this inflammation. And hyperbaric oxygen certainly seems to be one of those. If you're interested, please reach out to us at Better Life Carolinas, and we'd love to give you more information. Thank you for your time.